What's up, people? Uh, guess where I am? I'm in New York City, baby. I'm a little tired, but I just wanted to keep you guys posted on what's going on. It's kind of, honestly, I just wanted to, like, talk to some of you. Anybody who's, like, hanging around and wondering where I'm at and what's going on and whatever. I'm actually staying at a kind of nice apartment, and I'm going to check my audio here for a second, make sure it's not, like, blasting your ears out. Okay, so it's probably not blasting your ears out, even kind of.
I see.
So, it's annoying, I can't keep the chat open. Tomorrow, I get my fMRI guided, or I get my fMRI, which is what they use for some of you who may not be in the know. On my last live stream, I discussed that I'm traveling to New York City to have treatment for my neurological sequelae, which includes mostly anxiety, really bad anxiety, depression, visual, perceptual distortions, cognitive deficits, and then there's other ones, but those are the main ones that I'm hoping that transcranial magnetic stimulation will be able to tackle. So the first step in doing this transcranial magnetic stimulation was first finding these people, and they're the only people in the country. There are other countries that do it, but the price difference is negligible. They're the only people in the country that do outpatient fMRI guided TMS. So if I were to try to get TMS for this problem through the normal medical system and not through something that's like basically the free market, I would have to work my way up probably a long list of doctors, and they'd probably do what they always have done, which is poo-poo on my symptoms and not get me to where I need to be. So this is kind of cool, where I have the opportunity to have access to fMRI guided transcranial magnetic stimulation to help my neurological sequelae, depending on how you pronounce it, in a kind of more free market environment where I can go choose. And so the first step was getting to New York. I'm here. I'm finally settled in my apartment. It's like 27 degrees outside. Heater doesn't work. So I bought a little mini heater, and it's pretty nice because this bedroom, you can see this kind of wall off area. It keeps it separate from the rest of the small apartment, and so I can just blast this heater and get this room nice and toasty. And I start sweating, and it's not because I'm like hot. I'm actually dry as a desert usually. It's just, even no matter, there's like 2 people watching right now, but if anybody's watching, I just start sweating. I guess I get a little nervous. So, what is an fMRI exactly? Well, an fMRI, sometimes there's 2 types really. I guess you can consider one type an active fMRI and one a resting state fMRI. I don't think it's called an active fMRI, but it's something like that, where you're put into an MRI machine, and it uses the same technology as an MRI. And it measures blood flow to certain areas of the brain to check for hyper or hypoactivity. So if there's a lot of activity in a certain section of the brain, maybe too much activity, there's going to be excess blood flow because there's going to be excess need for oxygen in that area. The exact opposite for areas that are hypofunctioning. There's going to be less oxygen in that area. There's going to be less blood flow in that area. So I'll be doing what's called a resting state fMRI. So I won't be completing any tasks while they're doing it. The other kind, sometimes they'll have you think of certain thoughts, or they'll have you move your body in certain ways, or they'll have you look at certain images, etc., etc. I'm not exactly sure why I'm not doing that versus the resting state, but maybe they just want to see like where my absolute baseline is. But I'm keeping my peepers open while they're doing it because I want visual stimuli going in so they can see what's going on with my brain. And I imagine that fMRI is going to be pretty muffed up. It's not going to be looking pretty. Not going to look good because people go there for like depression, and their fMRI doesn't look good. I live in a weird world, and it's got to look bizarre. So I'm excited to one complete that. So I'll complete that tomorrow on Monday. It'll be in the morning, and then it takes a little bit of time to process. So Tuesday, Wednesday, it'll be processing because they literally take the fMRI and compare it to thousands of healthy subjects to find where discrepancies might be. So they run it through this massive algorithm where they compare it to all of these different healthy subjects of my gender and age, and use that to find where there's basically maladaptations or hyperfunctioning or hypofunctioning of certain parts of my brain so that they can stimulate or understimulate those areas in order to induce neuroplasticity and recruit local neurons to take over other processes, and to also just kind of calibrate the way that the neurons are firing so that they're firing in a more normal way. Hi, everybody. Feel free to say hi in the chat. So that's the first step, is tomorrow is the fMRI, and then I tell you what, waking up from naps is a trip, bro. I don't remember having this much anxiety ever until after chemo. I don't know what happened to flip the switch, but when I wake up, it's like I'm waking up in Vietnam. I wake up into a panic attack. It's crazy. And yesterday, I was sleeping at a hotel, and the housekeeping lady came in and started cleaning, and I woke up out of my nap in a panic, and she had no idea what was there, and she's like, Jesus, that scared the shit out of her because I was hiding underneath the blankets. But it's it's weird. It's like waking up in the middle of warfare. I just have just really bad panicky feelings. But that's the good thing about fMRI guided TMS, is that TMS is very specifically used for commonly depression and anxiety. And so so let's say it's used for that and it has a high success rate for depression and anxiety. Okay, we're going to treat those. And then we're also going to treat my neurological deficits, particularly my cognitive fatigue and ability, and my visual perceptual sequelae. And so let's say there's a higher percentage chance of improving depression and anxiety, which there is because it's more well scientifically backed. There is literature on using fMRI guided TMS for neurological sequelae for traumatic brain injuries, or MS even, or strokes, that kind of thing. But there's a lot of studies for it on depression. So if I get some improvement in my ability to function as far as my neurological problems go, so my visual perception improves 20-30%, on the conservative end of things, and my cognition improves 20-30% on the conservative end of things. But over here on the depression and anxiety, they improve 50-80%. It's going to make coping with my reduced neurological problems much easier. So it's actually I initially came to them because I'm this visual distortion shit is crazy. I can't handle it. It's too much. Can you help me solve this problem? They're like, yeah, we can probably help you. And I'm like, great. I'm still great. They talked about this. Their neuropsychiatrist, who's a medical doctor, talked about how they had a patient who had a stroke 30 years ago, and they could see the infarct on her MRI, and they applied transcranial magnetic stimulation to the area. And in her left eye, where her central vision was once blurry and her peripheral vision was once completely black, she regained her central vision and enough of her peripheral vision to start driving again. And in fact, there's studies on healthy patients that have TMS applied to the occipital lobe, the back of the brain where the visual cortex is located, and it increased their target acquisition and their basically visual reflexes. So, and then one person on one live stream, I think on my last health live stream, mentioned that their friend did TMS and it said it improved their vision for a little bit, even though he didn't have any visual issues. So there's a lot of hope in that department. And then for cognitive problems, that is very promising. And then for depression, anxiety, it's that's going to have the highest success rate out of all my problems. So if I can if I can get my anxiety down, life and my depression down, coping with my neurological problems is going to be a lot easier. So tomorrow is the fMRI. It'll take about an hour. They don't put any contrast or anything like that. So I've been poked so many goddamn times in my life. I don't think I'll be poked again tomorrow. And then it's Tuesday, Wednesday, and then on Thursday, I meet with one of their staff members who has 2 PhDs, and then the neuropsychiatrist, I think, and maybe another medical doctor. And they basically do a presentation to say, hey, look, here's your brain. Here's where it's fucked up. Here's how we're going to treat it. What issues do you have that you want us to focus on, et cetera, et cetera. And I've had conversations with multiple doctors via Zoom, discussing, my problems and such. But it's going to be kind of cool to actually see, because they'll put up my fMRI and compare it to healthy subjects, and they'll show where there's areas where there needs to be treatment applied, essentially. And so it'll be nice and almost reaffirming to see something on a test where it's like, yep, this is messed up. Because if you have depression and anxiety, it shows up on an fMRI. It's there. I have depression and anxiety, so it's gonna show up. My visual stuff is crazy. It's gonna show up. It's cool to have confidence in that a medical test is gonna show you that there's something wrong, and that there's something we can actually do about it. And it's also gonna be cool to be under the care of people who actually want to help you, because you're paying them money, versus people who are getting paid by health insurance, and they don't get any kickback for prescribing you Solu-Medrol or Cytoxan or whatever. So where's the incentive to prescribe it to their patients? They would rather not take the risk because they're not getting any money for it anyway. It's just whether or not the insurance covers the medication. It's different for diagnostic testing, but even diagnostic testing can sometimes be hard to acquire because it's just more paperwork for the doctor to do, and they have a bunch of patients to handle, and they don't want to deal with insurance denials and have to do peer-to-peer reviews, et cetera, et cetera. So in this case, it's going to be different in that they actually care. They want to help, because most of all because I'm paying them, and that's okay. That's okay, as long as there's scientific literature to back it up, and as long as they have cases of their own to back up their proprietary use of TMS. It's okay if there's a little bit of incentive behind the fact that I'm paying them to do this, because then it's just like going to a really nice barber shop, and you're instead of paying the $15 at Sports Clips to get a haircut, and you get a terrible haircut where they just zzz on the back of your neck instead of fading it, you pay $70 to go get your hair styled, dyed, whatever, at a nice barbershop. They're gonna talk your ear off. They're gonna love you. They'll give you a warm towel to put on your hands and on your face in the wintertime. And it'll be scented with lavender. They're gonna make you laugh. They're gonna play nice music. They're gonna give you a neck massage. All that stuff. They care. Because is that all bad? No, it's great. Do they actually would they want to on a normal day give you a neck massage for free? No. And that's what normal doctors are. It's would they want to give you treatment just because? No. Why would they bother? But when you throw money, if they got a kickback, they'd be like, yeah, let's do it. Who cares? So it's yeah. So the fact that it's kind of a more free market thing is kind of cool, because they actually they care now. They care now because they want to make sure that I leave them good reviews, I get my money's worth, et cetera, et cetera. So on Thursday, they'll do that presentation where they go over my fMRI results, and we discuss basically the targets, which are the areas of the brain that we want to apply the TMS to. And then we'll start doing it that day on Thursday. And we'll be treating multiple areas per day and doing multiple sessions per day. So it's a 5-minute walk from where I am. I'm in Manhattan right now. It's a 5-minute walk, Upper East Side. And I'll go there. I'll have my session where they hit multiple targets for depression and my neurological issues. I'll come back. I'll probably be exhausted from it. I'll nap. I'll wake up. I'll go back again. Bam, they hammer those spots, different spots again. Come back to bed, probably eat some food, whatever. Go back. It's a 5-minute walk, and then they'll hammer the spots again, and then go back and be done for the day. But I'll rinse and repeat pretty much 6 days out of the week until the end of the month. I'll be here until February. Dude, Lefteris, Dorsanis, it's always good to see you, buddy. I appreciate you. For anyone who's in New York, I don't know, is anybody in New York? Let me know if you're in New York. It's always nice to see familiar names in the comments, so I appreciate you, bro. If you're in New York, at the end of this, I would like to meet up with some people who are in New York. So you happen, I mean, there's only like 9 people watching right now, but if you happen to be in New York, throw it out in the comments, and I'll share the Discord where I'm having some people meet up with me in New York City, hopefully by the end of this. So when can I expect response time? So for uh, anxiety and depression, I can start seeing improvements within a week, and then I can definitely notice some improvements within 2 weeks, and then it can fully evolve over the course of a couple months. As far as my cognitive and visual sequelae, those will take a little bit longer. It may take 3, 4 weeks before I really start noticing things, and then several months to 6 months for it to fully develop, because it's like it's knocking neurons loose, so that it's like re-stimulating neuroplasticity. So it's going to take time for those neurons to create those new connections and for me to see those results. For me, that's okay. I would rather get this anxiety down so I'm not on the verge of a panic attack at all times, than deal with the neurological issues. So psychiatric, I'm so happy that there's such a high probability of success with the psychiatric treatments. And then as far as the neurological stuff, I do want that resolved or partially resolved, and I fully expect that, but I don't mind waiting for that. I can handle that. It's the waking up like I'm in Vietnam that is extremely taxing. Am I near my old hood, but I live in Portland, Oregon now? Aw, damn. Glad to see you able to bend the system enough to work for you. There needs to be reforms, though. Yeah, I mean, the healthcare system in the U.S. is such a tangled, garbledly mess. I don't know where you would even begin to untangle it. And I don't know how you undo doctors' egos, especially neurologists' egos. But I mean, many people go to doctors. They just get tired of hearing patients Googling stuff and saying, like, do I have encephalitis because I had a panic attack yesterday, But, like, when I had encephalitis, I was, like, in psychosis. So it was, like, a whole different thing. But they're like, oh, another person who thinks they have a grand illness, right? They're literally taught in med school to look for horses, not zebras. Look for the normal stuff. We're not looking for the crazy stuff. Why is that? Because 99% of the time, it's going to be the normal thing, right? It's going to be, oh, this guy's just having he's having a manic episode, and so we just treat him with antipsychotic. He'll be fine. They didn't take into account that the antipsychotic didn't work on me, but that's what they said for me. And he was looking for a horse, not a zebra, and I was a zebra. And so, but you have all these people going to docs and thinking they know what's going on, and there's a lot of I don't know if you know this. There's a lot of dumb people out there. Just browse some of the health subreddits. They're barking up the wrong tree a lot of the time. So some patients really, really know what they have, and other patients are just like purely speculating and have no idea what the illness even means. And so that weighs on doctors' minds when it comes to taking patients seriously, and so often the times are quite dismissive. And Eric and I, my twin brother and I, experienced that for a long, long time while we were trying to get help for our autoimmune encephalitis. We got knocked down by doctors left and right for ages. It took 6 months just to get Solu-Medrol, and the damage that occurred in 6 months was crazy. MI is true. I'm hoping AI will help doctors find more needles in haystacks. Humans aren't meant to do that consistently for many cases at once. I agree. So the way they are taught kind of makes sense. And you know what? The very first, one of the first things I did was I punched it as soon as AI came out. I punched it into an AI bot, and it shat out autoimmune encephalitis as the top, out of like 5 different possible diagnoses, as the top diagnosis. And as AI evolved, I kept doing the same thing, punching in all my lab numbers, all my symptoms, the time frame, the timeline, everything, and it kept saying it was autoimmune encephalitis as number 1. And you go to a doctor and they're like, it's not autoimmune encephalitis, you're having a manic episode, or we don't know what it is. And because the protein in your spinal fluid is non-specific, meaning we can't identify it with a certain disease, we are just going to ignore it. I mean, literally, my brother had atrophy in a part of his brain on his MRI scan, but because it was remote, basically saying that it had already been there from his previous MRI scan, which was not done that long ago, they just overlooked it. and then he had quite elevated protein in his spinal fluid, which could be autoantibodies, it could be myelin sheath breakdown from neurons being broken down by autoimmune attacks, basically. It can be albumin leaking into the cerebral spinal fluid from your blood because your blood-brain barrier is compromised. It can be a lot of different things. Everything's made up of proteins, right? But it indicates some sort of disease activity, and they discharged him. He had like seizure activity, high protein in his CSF, some atrophy in his brain, and they discharged him with no diagnosis besides functional neurological disease. Crazy. And that made every appointment so stressful because you just didn't know what you were going to get. You prayed to God that they were going to give you what you wanted, what you needed, what you know you need. I mean, the fact we responded to steroids, it was like blatantly obvious. It's like, well, hello, we have an immune issue going on here. Anyway, but finally, when we landed in that good doctor's lap, it was like pure heaven because she would just stepwise win us through, IVIG, rituximab, plasma exchange, which is a real trip because they shove a tube down your neck and they just suck your blood out and clean it. It's basically like, was it when people's kidneys aren't working well? You know what I'm talking about. And, oh God, that was terrible. I didn't tell Eric about the tube, how bad the tube going in the neck was, it goes straight into your jugular vein, like way deep. And I didn't tell him because it was just awful. And then when he got it, he was like, Jesus fucking Christ, why didn't you tell me? Dialysis, thank you, it's dialysis. Thank you, W. Dialysis, it's basically the same thing. It's just scrubbing it takes my, literally was separating my blood from my plasma and taking my plasma, which contains autoantibodies and immune factors, and literally put it in a bag. I could see like this kind of pale, milky, yellowish bag of my plasma from my blood, and then they'd replace it with basically saline and basically clean my blood out that way. And that gave me improvement for 4 days. I had massive improvement for like 4 days. It's supposed to last months. It was terrible because I was like, okay, at least I'll have like a month of relief. It was like 4 days and then went back to hell. And so my last appointment, I was talking to my doctor and she's like, sometimes these things are just, you're stuck with some things. Like right now, I'm stuck with things, and I know that the autoimmune activity is over. I can feel it in my body. I live in a crazy world right now, and I still know that there's nothing active going on. But she told me at the time, she's like, sometimes you're just left with stuff, right? And I was like, this is absolutely not normal, and I want Cytoxan. And I'd asked her multiple times before, but I was very forward at that point in time because things were getting desperate. I was not about to be cock-blocked by the best doctor I've been with since then, since the beginning. And as soon as I said that, she said, okay, we'll do Cytoxan. And I was like, thank God. I thought it would take my visual problems away, but it hasn't. But that just means it's a functional issue. I have no brain damage on my MRI. My brother did in his prefrontal cortex, which is probably why he was emotionally dysregulated. MIs again, oof, good doctors are few and far between. And they still work in a hospital and insurance system that it can be hard to be effective within. It's very true. This doctor had to fight for our treatments really hard, doing appeals, extended appeals, peer-to-peers, appeals to the state board of insurance. That way, you're not talking to any insurance company. You're actually not talking to any doctors affiliated with the insurance company. You're talking literally to the government, your local government, I guess, state government, and appealing to the state board of insurance and going, look, hey, I need this treatment. Can you please just tell the insurance company fucking stop, approve the treatment, And so that's what it took to get the treatments we needed. So for those of you guys catching up, tomorrow I have my functional MRI, and we'll talk about that here in a second because I got nothing else to do. It's 4:09, and what am I gonna? I got. Hello. I'm not gonna walk outside. It's like 20 degrees. It's freezing, and things look weird, and I don't feel well. So like, why would I go outside? It's all cozy in here. It's nice. So tomorrow's my fMRI. 2 days and Thursday, it's I get my presentation and I start treatment. right? And then it's 6 days a week, every week until the end of the month, which is going to be awesome. So let's talk about, and I'll try to check the comments from time to time here because I can't keep the live chat open for some reason. It's being really. Can I pop it out or something? It's being really annoying. Pop out. Yay! Oh, good. Okay, it still goes away whenever I click on something. Okay, hold on. I just want to make sure you guys know that I care about you and want to respond to your comments and stuff. Let me close out of any weird or sensitive information here. Sorry. Channel. So we're going to talk about what my fMRI is, basically. So we do that. Let me make sure I'm on the right screen. I'm not. There we go. I'm on the right screen. So this is kind of a corny article, but it gets the idea across of what an fMRI is. So it'll look something like what's shown on screen is in the thumbnail, where it shows where there's hyper or hypoactivity. It'll show a lot more than this. It'll show a lot throughout the entire brain. This is just highlighting certain parts of the brain. Specifically, it says when you're drinking a cup of coffee. So this is anyway, this is like a stock photo, so probably not even that reliable. Let me see like what an fMRI photo looks like. So this is more like what an fMRI will look like. This is for post-concussion. I'll zoom in if I can. I can't zoom in, unfortunately. But you can see it's going to show a lot more activity and hypoactivity on the brain. I don't even know how to interpret it. But basically what an fMRI was something that was discovered in the 1990s, in the early 1990s, and is a functional MRI. And by functional, it means it's not looking for structural abnormalities, it's looking for functional abnormalities. Christmas tree of the brain. Very cool. Does it show blood flow? Exactly. That's exactly what it shows, right? These are areas of, you can see like I'm assuming, I haven't interpreted an fMRI myself, but the brighter the area, the more blood flow that is being sucked in, basically. I'm not sure what the blue is. But it's to track where the oxygen is going, where the brain is needing blood. And so if there's like a part of the brain that's needing way too much, then it needs to be corrected. It's basically my understanding of it. And I'm sure I'll grow to understand it further as I go down the treatment. So when it's the normal MRI, basically it makes sure that everything's in the right place. For instance, any signs of damage, such as bruising, if so, there might be a concussion. In contrast, an fMRI takes your brain's activity while performing a particular function, not in this case, which I'll discuss in a second. I'll show in a second. It can even see your thoughts and feelings. So when you actually have certain thoughts or feel certain feelings like depression or whatever, it's going to show up on an fMRI. An fMRI is essentially creating a functional map on top of the brain images. So it does take brain images, right? But we're not looking at structural abnormalities. So during an fMRI scan, you might be asked to perform tasks. That's not what I'll be doing. I'll be doing this. And other times, you might be asked to just relax in the scanner. This is known as a resting state fMRI. It helps both typical and atypical brain connectivity in a variety of conditions. And my condition would be post-encephalitic neurological sequelae, I guess, similar to traumatic brain injury. I wonder if I hit my left arrow key if it just brings up the camera or not. No, I literally have to have OBS open. But it's very similar. There's studies on traumatic brain injury. It's very similar, right? It's a traumatic brain injury. Some guy walks up and hits you on the side of the head with a bat. that's going to show up on an fMRI. There's going to be issues with your brain, right? If you're having cognitive dysfunction or whatever, having trouble walking, visual problems because it hit you in the occipital lobe, that's going to show up on a functional MRI. It's the same deal with when you have encephalitis, is your body goes in and it's a bajillion tiny little bats, not like bats that fly, but like bats for baseball, that go in and just start whacking on your neurons. So there's an overlap there when it comes to traumatic brain injury and something like encephalitis, is that your brain is just being injured. And so there are things that are going to show up on the fMRI. Let's see. So an fMRI uses a powerful magnetic field, of course, like a normal MRI, to detect activity in different parts of the brain. So it's used for a lot of different things, but you can see that it's used for epilepsy, concussion, post-concussion syndrome, mental illness, neurological conditions, etc. And it's really boring stuff because, I'm in HIMSS. I'm up a lot. They do HIMSS and HERS, right? I'm up quite a bit on HIMSS and HERS. So it's going to be pretty much the same as the normal MRI scan, which if you had one is just a bunch of loud noises, right? It's not nothing crazy. But if I ask ChatGTP, and we can use their newer model, the O3 Mini, how does an fMRI guided or help in fMRI guided TMS? Yeah, I know. It's amazing that it came out in the 1990s. And it's not really used to diagnose anything, which is kind of a little bit weird to me. I guess it'd be incredibly non-specific. It would just acknowledge that there's some dysfunction. But, I mean, that's kind of like what a PET scan does, right? Maybe not. Maybe I just don't have a full understanding. But it's not used very much clinically, as far as I understand, to diagnose illnesses. So let's break down an fMRI again, but from one of the best AI's perspectives. Breaking down fMRIs and transcranial magnetic stimulation. fMRI identifies brain regions while TMS uses magnetic fields to stimulate specific areas. Functional magnetic fMRIs play a crucial role in guiding transcranial magnetic stimulation, which is TMS, which I frequently call it, by helping clinicians and researchers identify the specific brain regions to target for stimulation. Here's how fMRI contributes to fMRI-guided TMS. Mapping brain activity. Functional localization. fMRI measures brain activity by detecting changes in blood flow. And they do that particularly because they're looking for where the oxygen is going. If where the blood flow is going is where the oxygen is going. That's the real purpose. It helps identify which brain regions are active during specific tasks or in response to certain stimuli. Again, I'm not sure why I'm doing a resting state fMRI, but I'm assuming they know what they're doing. This mapping allows clinicians to pinpoint areas that may be underactive or overactive in conditions like depression, anxiety, and other neurological disorders. So like I said, depression and anxiety, those are the main ones that TMS is addressing. And using an fMRI to pinpoint where the depression and anxiety is specifically located in my prefrontal cortices is going to increase my probability of success and complete relapse from these problems. And then neurological disorders can come second and will help as well. Dude, I hope so too. Do you read me? Says, I hope so hard that this works for you. I struggle with something. I don't know if it's a thing that is some sort of like logical fallacy where if you believe something is going to work, it's not going to work. Like I have that kind of mentality where if I go into this thinking, this is going to work for me, I basically jinxed it and it's not going to work. Or if I go in with my hopes too high, I'll end up disappointed. But like, what if I go in with my, some level of measured hope and optimism, and what do you know? I start having less depression, less anxiety, less visual disturbance, more cognitive function. What if those things actually happen? And like, I've run it through, I'm an AI slut, so I run it through all the AI bots, and I have them argue against each other to see who has the best conclusions as far as what makes the most sense as far as outcomes go with fMRI guided and TMS. And I literally have them argue against each other and come to a conclusion that way. And there's not a single, even the prickiest of all AI bots, whether it be DeepSeek or some version of ChatGPT, which can be really cold and calculated and based on research, they all basically say, like, at a minimum, when it comes to your neurological problems, you're going to get at least a 20 to 30% improvement. To expect that. They say it's a conservative estimate. A more optimistic estimate would be 50 to 80%. And as far as anxiety and depression, pretty much across the board, I can expect at least a 50% to 80% decrease in anxiety and depression, with a chance of full remission in both of those, especially with it being fMRI guided. Okay. Identifying dysfunctional networks. In many neuropsychiatric conditions, it's not just a single brain region that is affected, but entire networks. fMRI can reveal how different regions interact, functional connectivity, which aids in understanding the network dysfunction underlying a disorder. Target selections for TMS. Individualized treatment. By using fMRI, clinicians can tailor TMS treatment to the individual's unique brain. Sorry, I don't have much room on my trackpad. Unique brain and activity patterns, rather than relying solely on standard anatomical landmarks, such as lesions that you'd find on a normal MRI. This individualized approach can enhance treatment efficacy. Precision targeting. We all know where this is going. Once an fMRI scan identifies the region or network implicated in a disorder, for example, the dorsolateral prefrontal cortex in depression, that information is used to precisely position TMS coils over the target area. This precision increases the likelihood of modulating the dysfunctional neural circuits effectively. Right, because they're dysfunctional. It's a functional issue, right? It's not a physical structural issue. It's a functional issue. The neurons are not working well. They have maladaptive patterns, etc. It's a functional problem with the neurons themselves. They're not really active, etc. It's not necessarily damage, and that can be backed up by the fact that my PET scan was normal, my brain PET scan is normal, my MRI was normal, and I personally had never had any seizure activity, although Eric did have some certain type of seizure activity. Optimizing stimulation parameters. Understanding functional connectivity. fMRI data can inform which parts of a neural circuit should be modulated to achieve the desired therapeutic effect. For instance, stimulating a region that is a key hub within a network may have a more widespread and beneficial effect on the overall brain function. So, for example, if I have problems in my occipital lobe where my processing of images is, let me open OBS here. I just want to see how many people are still here. Okay, like 15 people here. Cool. Thanks for stopping by. So when they apply TMS to my occipital region, for example, not only does it hit that certain target, but it also radiates through my the neural pathways involved with visual processing. So it helps with that target, but it also helps with the functional connectivity throughout the pathways that are involved with my visual functioning. So just an added bonus. MICE. I've heard Germany and Brazil have excellent medical care that you can pay reasonable amounts out-of-pocket costs for. It might make sense if hurdles to get stuff approved in the U.S. are too much. This is true for a lot of things. It's not true for this one. I've looked for, medical tourism for fMRI-guided TMS. There's Germany and Japan. You still have to work your way up the medical system, and it won't. The cost comparison is too similar. If I were to pursue other things like vagus nerve stimulation or whatever, if this doesn't resolve all my problems and I want to pursue further therapies, I would of course look at going abroad, because there are places that you can have this done for cheaper. And I might be overlooking something. Then maybe there is a location where they do this, but the place I'm getting it done at, which you can probably easily deduce by the fact that I'm in the Upper East Side Manhattan and I said fMRI TMS over and over again. Maybe I'll show a video of theirs, because I don't really care about doxing myself. What are you guys someone gonna shoot me? Maybe I'm overlooking it. Maybe somewhere there was somewhere cheaper or whatever. But these people have a proprietary understanding of or method of delivering fMRI guided TMS, where they literally put a cap on your head. I see your comment, W. Hold on. They put a cap on your head and they use a pin, and on the screen you can see a virtual 3D image of your head, just your face and your head, and then also your brain, the fMRI scan, right? So they use this pin to find the precise area where there's where they found through running it through their algorithm against thousands of healthy individuals where there's problems, and they can directly to the millimeter target that area. W, also wishing you well, all the best in the coming weeks. From what I see with a quick Google, there is definitely quite a bit of research backing up fMRI TMS. I wonder how a TMS works biologically. Targeted electromagnetic charge rebooting neural links. Basically, I mean, I don't think people even know exactly how it works, but they kind of use simple terms like it shakes up the neurons, and so it breaks the maladaptive patterns and gets them to start acting. You know what? I know this clinic knows their shit. I talked to the doctor. Half the stuff went over my head. So what am I saying? They know how it works. I just know the simple understanding of how it works. Do you read me? Do you think this therapy possibly encourages neurogenesis? I'm not sure if it increases brain-derived neurotrophic factor. I wonder if I can check that. Does TMS increase brain-derived neurotrophic factor? It's BDNF. Do you think this therapy possibly encourages neurogenesis? I know it's supposed to slow down in adulthood, but as AE really fries your hippocampus, where most of your receptors are concentrated. There is evidence suggesting that transcranial magnetic stimulation, particularly repetitive TMS, may increase levels of brain-derived neurotrophic factor, which is involved in the generation of new neurons, a protein for neuroplasticity, neuronal survival, and synaptic modulation. However, the research findings are not entirely consistent, and the factors, and there's just some variability in as far as this research goes. Albert Camus's Final Drive. I definitely believe in managing expectations, but this seems promising. Rooting for you to get good results, my man. Thank you for being the best guy on Finance YouTube. Thank you, bro. I'm trying to, you want to manage your expectations, right? But it's kind of okay to be excited. To get in New York and get in this apartment and get to where I was half a year ago was just starting to find out about. Over half a year ago I started finding out about TMS, and then now I'm in New York. And I'm set up in an apartment. I got groceries, and tomorrow's my fMRI. It's hard not to get excited, but also you have to measure your expectations a little bit because you don't want to be absolutely destroyed. Because if you go in thinking everything is going to be cured to 100%, and then you get 30 to 20, 30, 40, 50% improvement, then you're disappointed. But really, that's life-altering improvement. So for me, I'm trying to go into it thinking if I can get 30 to 50% overall improvement in depression, anxiety, visual sequelae, cognitive dysfunction, I'll take that as a huge win. Not only will it be easier to cope with neurological sequelae when they're less, but it's going to be easier to cope because I have less depression and less anxiety. And it's just going to open up life a lot more. So even if I have moderate improvement, it can still be life-changing, and I can still pursue different therapies down the road. And there's technology advancing all the time. Daryl Rubin, so which biotech stock are you most bullish on? I am not invested into a single biotech stock. Probably couldn't name one. I have been going hard on the elliptical for 1.5 hours plus trying to simulate the production of BDNF. Yep, that'll do it. Unfortunately for me, I hit the gym still. May not look like it, I got some guns a little bit, kinda. How big does look? A little bit veiny. But but when I exert myself, I get really hungover. I have post-exertional malaise, so that's a pain in the ass. Okay, let's go back to our fMRI stuff and keep on plugging away at it so we can learn. Let's keep learning, because I'm learning too. Albert Camus's Final Drive, you've got a really good mindset and you've been resilient through everything that's been thrown at you. I gotta check out now, but wishing you well. Alright, thank you, dude. Thanks for stopping by. I appreciate all the kind words, and we'll circle back around. I'll see you live again soon, and I'll remember your name, of course, so I hope to see you on the next live stream. But for now, have a wonderful rest of your day, and good luck with the upcoming work week if you work a normal 9 to 5. Alright, I just saluted the camera, but I don't even think I have the camera open. So I'm talking to... Sorry, let me give you a face. Goodbye. Salute. Okay. Guided stimulation, intensity, and frequency. While fMRI doesn't directly dictate TMS stimulation parameters like intensity or frequency, knowing the functional state and the connectivity of a target area can influence how these parameters are set to achieve optimal results. Monitoring, almost done. Monitoring and adjusting treatment. Pre and post treatment comparisons. fMRI can be used both before and after TMS, right, to assess changes in brain activity and connectivity. This helps in understanding the treatment's impact and refining future stimulation protocols. So they actually have talked to me about this directly. The fMRI is very expensive. So, well, not it's expensive. We'll just say it's expensive. So it depends how much improvement I get. If I start getting some good improvement, it's like, well, it's worth investing, maybe getting a post fMRI to see where there might be other areas that we can keep working on. If I only get mild improvement, then I'm going to be kind of like, yeah, I'm not really going to keep feeding the fire. Because I'm already doing, like, I mean, the fact that I'm in New York doing this shit is just crazy to begin with. I miss my puppy. Lastly, adaptive protocols. Emerging research is exploring adaptive pre-EMS protocols where ongoing fMRI might help stimulation in real time or between sessions, though this is more experimental at present and I imagine would be quite costly if it were a more public thing. And we can talk about how TMS works, but maybe we'll save that for when I'm actually receiving TMS, because I'll have more information. They'll have given me the presentation. I'll have the recording of the presentation probably that I can share with you guys. And let me kind of show you what... I'll show you the place. The place is called Neurotherapeutics. And we can watch a video really quick and then... how TMS works. I think they have a video. They have a lot of patient severe depression. What is fMRI guided TMS? Here we go. So let's start with this video. Let me know if I'm blowing your ears out here. I don't want to blow your ears out at all, but I do want to kind of share some time together learning more about how TMS works. It's a very short video, so if you just want to stick around for just a few minutes if you're interested. Yeah, let me hit play, make sure the desktop audio is reading. It's not, so hold on. So this is actually one of the doctors that I spoke to directly. Properties. Would that be it? I doubt it, but let me find out.
Stimulation is a non-invasive brain stimulation technique.
Here, I'll link the video. How's that? So this is one of the she's a doctor. She's a doctorate. Just 2 doctorates. I forget what they're in, but she's a person I spoke with. I'll post a video in the chat. And this is the group I'm going with, and so if you want to watch that, you can kind of learn a little bit more about that. If you want to browse their website, you can learn a little bit more about that as well. With that said, I don't have much more to say about what's going on besides the fact that I'm absolutely elated to be in New York right now. I could not wait to get out of town and just get started. So I'm so happy to be here. I love the fact that I have a heater in my nice cozy room. It's great. It's perfect. It's a small room. Perfect. Looks beautiful. Doesn't have much of a view. Looks like shit out there. That's New York probably, but it's good for me, and I can't wait till Thursday when they start zapping my brain. I get to see my fMRI. It's gonna be so cool. I'll share it with you guys, and they'll start zapping my brain. And I mean, they use these little figure 8 coils use magnetic stimulation, so it induces a electromagnetic field to change the way neurons act and behave and interconnect, etc. And I'm sure if you delved into more studies, you can get in more jargon out of it. But really, what more do you have to know the jargon to get the general gist of the idea? That's kind of how I've lived my life. Is like, maybe to my own detriment. Is like, if you get the general gist, you got the gist. But you do have to know everything to the minutia. I do with options. But like, even in that area, it's like when people talk about, how do you feel about the jaded lizard, or like some guy asked me about collars. I was like, I haven't traded or thought about collars in like 5 or 6 years. I have no idea. If I don't care, it's out the window. But if it's something I'm really interested in, I'll dive into it. But anyway, I just get the gist of how the TMS works. I get the gist of how the fMRI works, and I've done a ton of research on this because, of course, I'm very, very interested in fixing my neurological sequelae because they affect my life drastically. So I've been researching this quite heavily, but still a lot goes over my head just because I'm not a neurologist. I'm not a neuropsychiatrist. A lot goes over my head. I just get the general understanding of how it works and how it functions. W, thanks for sharing the video. Very impressive to see. Yeah, you should. I almost want to share. I probably unprofessional of me, but just share the conversation I had. I have it saved to YouTube, unlisted. The conversation I had with a neuropsychiatrist, and it's just. I actually had really low hopes until I got here, and then now that I'm here, I'm like, maybe I have a chance. Maybe things actually, maybe the world doesn't hate me. Maybe my luck will keep turning around, Because he was talking about that patient who was, blind and regained vision, and the front desk lady was talking about patients with visual issues who, almost had a complete resolution of their visual problems. And he was saying that, of course, we can address your depression and anxiety. There's a super high success rate for that, because that's what it's primarily used for outside of neurological problems, which is really at the bleeding edge of dealing with neurological sequelae from concussions, TBIs, which is a type of TBI, something from an autoimmune encephalitis, or having something like a stroke and having visual neglect, where you just are neglecting, your brain is neglecting to see or process one side of your visual field. TMS actually improved that for about 66% of patients that had that. They regained their perception of that side of their visual field. Darrell Rubin. Sorry, what's the name of the condition you were diagnosed with again? It's called autoimmune encephalitis. So what I'm dealing with now is just the remnants of it wrecking my brain. So autoimmune encephalitis is just your immune system attacking your brain. It can be done through autoantibodies. It can also be done through different types of cells, like B cells and T cells, which are types of immune cells that can turn against your brain. And B cells are involved in the proliferation of antibodies, autoantibodies. Antibodies in general, but if they're antibodies against some part of your brain, there's NMDA receptors on your brain, but there's also NMDA receptors on ovarian teratomas, which are a type of tumor. And if your body starts attacking those receptors on the tumor, it can also attack the same receptors on your brain. That's called NMDA receptor encephalitis. And so it starts attacking both the tumor and your brain, and that's why they did a scan of my testicles, and that's how they found out I had testicular cancer and I got a testicle removed. It's because they were looking for any side of what would be called a paraneoplastic syndrome, where antibodies are attacking a tumor, but there's a corresponding receptor site on my brain that is also attacking at the same time, and that would be called an autoantibody, because it's auto meaning self, so it's attacking yourself. And so I had autoimmune encephalitis. Autoimmune meaning it's against self, your immune system is against self. Encephalitis is brain inflammation, basically. So you have your immune system attacking your brain and causing inflammation and damage, etc. And so what I have now are what it's called sequelae, which are results of a prior injury, whether it be encephalitis, traumatic brain injury, stroke, anything like that. It would be called sequelae. You might have tremors, you might have speech issues, you might have trouble swallowing, you might have trouble walking, stuff like that. When people have encephalitis, sometimes they have to relearn how to speak again, or have a stroke and they have Dysphagia? No, that's trouble swallowing, right? But they have a broker. I can't remember the word. They have trouble speaking. That's called a sequelae, and they can retrain that. And through heavy speech therapy, there's someone on YouTube you can look up called. Her name is Sarah Scott. She's on Broca's aphasia. I think it's called aphasia. But she had a really hard time speaking, and she documented her improvement over time, and now she can speak almost to the point where you can't tell. But initially, she could hardly speak at all. Dale Rubin again, what was that connected to the cancer in your ball, or was that just coincidence? As far as we know, it was coincidence. As far as we know, there is half my testicle is literally split in half. One half went in the garbage, I think, and another half is saved at some university hospital. I forget where. Or at some point they will do research on it. Same with forgetting how it worked. Anyway, and just no, it didn't seem to be correlated. It seemed to be coincidence. My type of cancer was not a glial cell cancer tumor. It was a Sertoli tumor, which makes up like 0.05% of all types of testicular tumors, so it's incredibly rare. And glial cell tumors are more associated with autoimmune encephalitis. Aphasia. Okay, so I'm getting it right. Do you read me says when you lose your words in the middle of thought. There's different types. There's like one that's called like Broca's aphasia, I think. Actually, I wish I could share my desktop audio because it's really interesting. But let me show a video of Broca's aphasia. I'll share with you in the. Please let me open a new window. Okay, YouTube. It's where people they think they're speaking English, but they are speaking English, but they're just saying random words. Broca's aphasia, something like that. Yeah, Broca's aphasia. Here, this guy. Crazy, crazy stuff. Skip the ad.
Worldwide.
So just listen to this guy talk. This is Broca's aphasia. It's crazy. He thinks he's speaking complete, total sense. He's speaking nonsense. The brain is a computer that can malfunction in fascinating ways. Disturbing ways, for sure. But also fascinating. The disturbing and fascinating have a great overlap. And with this person who has Broca's aphasia, he thinks he's speaking plain English. He is not. He is speaking gibberish, but he thinks he's saying complete and full sentences. There's also people who have their I'm blanking on words today, dude. My medical terminology is flying out the window. Basically the sheath that it divides the two halves of your brain, the two hemispheres of your brain. Sometimes they'll split that to help people with seizures, and it can cause basically your right and left side of your brain to not communicate and to behave entirely differently. So, for example, if you cover your... I'm going to get confused here because your optic nerves cross in your head. But if you cover your right eye, let's say, for example, and you're shown an image with your left eye and you're told to draw it with your left hand because your left eyes process it on the right side of your brain, your left hand won't be able to draw it. Even though you are seeing it and can recognize the object, you won't be able to draw it because your left hand is being controlled by the right side of your brain. Oh, fuckers, I'm getting all fucked up. Anyway, it's just crazy. Do you read me? It's what I'm struggling with. Currently waiting for... Oh, so you are. Wow. Currently waiting on a spinal tap. That was a really poor explanation I just gave, by the way. I apologize for that. Seattle neurologists are all too scared to touch me with the 10-foot pole. Yeah, that's where we went. God damn it, dude. What is my brain sucks. What is that place in Seattle? Where have you gone in Seattle? Seattle neurology. Was it UW? Where did we go? Tell me where you went. Any neurologist you went in Seattle? I'm forgetting the name of the place, but yeah, we went to Seattle, of course, because it was close to where we lived. And um, uh, it's hard getting a spinal tap. You might look into talking with a, I'm not a medical professional, but talking with a fuckers internal medicine doc. I think it was UW that we went to too. I'm trying to remember. Do you remember the name of the doctor you saw, if you don't mind me asking? This is a doctor my brother saw. I only saw him once via video call. So his name is Dr. McCarthy. That's what his name was. Let's look. Dr. McCarthy, Seattle. He almost didn't give us steroids. Dr. Lucas McCarthy, neurologist. Let's see what he's part of. Virginia Mason. That's where he went in Seattle. It was Virginia Mason, and it's Dr. McCarthy. There's a reason why he has 7 reviews and they're 3.9 stars. You might look into internal medicine docs because they're more interested in figuring out what's wrong with you. So, like, I went to an internal medicine doc. I was like, I would like a spinal tap. And he was like, okay. And so he did a basic spinal tap. But he didn't, of course, do all the autoimmune panels and stuff that you'd want out of a neurologist. Ultimately, you do want that. But it did show, like, elevated protein, which is really the main thing that drove my case forward, was the fact that I had elevated protein and high intracranial pressure. They're non-specific, which is unfortunate. But anyway. That's how you found out about me and my brother. The insomnia, the aphasia, the out of control anxiety, did go through psychosis. So I had the same thing where my brother had intense insomnia for months where he wasn't sleeping at all. I had aphasia in the way where I would replace words with words that meant something totally different. So I would say, oh, my computer's going to die. Let me plug it in really quick. So I would say, like, I'm going to go take a shower. But instead of that, I would say, I'm going to go take a stool. Or I'm going to go take an orange. It would be a totally different, unrelated word. And then I would shift. And all of a sudden, I could talk fluently. And then it would shift back. And I'd have a hard time talking. And then I'd switch words. And I couldn't talk right. And I couldn't swallow. And then it would switch back. And I'd be able to talk fluently again. And, I was getting gaslit by my own family, honestly. How's my brother doing these days? He's in the same boat as me, so, dealing with really intense anxiety and depression. Mostly anxiety is really bad. And then, of course, the visual sequelae and the cognitive deficits, and then tremors and some other things. But we're in the same boat. We've been in the same boat since day one, almost. Our symptoms have overlapped almost identically. There was a point in time where they didn't, because I actually took some CBD, and because my blood-brain barrier is compromised, it induced psychosis for me that caused week-long panic attacks. So that was not fun. But that was one time where our symptoms did not overlap, but that kind of resolved into, I still was in psychosis, but my brother eventually broke into psychosis too without needing the help of some CBD that I was trying to use to help me sleep. Anyway, so he's in the same boat as me these days. You referred to 4 different neurologists total. Yeah, we saw 8 or 9. So it's a pain in the ass, but you'll get there. You'll figure it out. It's just a pain in the ass. There's no way around it. Neurologists get off on being withholding when it comes to medications and spinal taps and that kind of thing. One thing you want to do is, again, this is not medical advice, whatever, etc. But like, for me, I would over-exaggerate everything, because otherwise you don't get the attention you need. And I don't go in saying what I have. I go in with all the right symptoms and clues and allow them to piece it together so that they think that they figured out what I have. You have to kind of play a little bit of mind games. It doesn't sound, when I was first told this by someone else who had encephalitis, I was like, that sounds dirty and wrong. But then when I actually utilized it, it was way more effective than going in and saying, I think I have autoimmune encephalitis. Can I have a spinal tap? You let them put the pieces of the puzzle together, and you let them get concerned and have ideas, and then they launch into doing a spinal tap, unless you find a real good one. Do you read me says, oh, we called the Mayo Clinic directly. We did as well. If this doctor lets me down, I'm flying there and paying out of pocket. Yeah, the Mayo Clinic rejected me. Just joined the stream. Did you start TMS? Thanks for joining the stream. WHM 1595. I haven't started TMS. I'm in New York City right now, Upper East Side, Manhattan. If you're there, let me know. But tomorrow I have my functional MRI, and I'll start TMS on Thursday. So that'll be really exciting. I'll be able to share some videos with you guys. The CBC really does help. Jeremy says, like your tongue became a ball. Yeah, it was like my mouth was full of marbles or mashed potatoes or something. I couldn't talk. You think the video just cut off? Let me check the video. Yeah, it did. Here it is. Properties. Hold on. Turn the camera off and back on, probably. There we go. Alright, that should be good, right? You're currently on prednisone. It does not feel enough. So prednisone... What do you think you have? Do you think you have autoimmune encephalitis or encephalitis of some kind? Because prednisone is like, so the first treatment I got was Solumedrol, which is like infinitely more strong than prednisone. It is a 5-day course or 3-day course of 1 gram Solumedrol per day is like prednisone on steroids, ironically. Yeah, when Mayo rejected me, it pissed me off because I had my neurologist write a referral, but she took weeks to write it, and finally we got on our ass about it and was like, "What? Where's the referral? Where is it? Send it off to Mayo." And then she sent off this pithy thing to Mayo, and Mayo's like, "Nah." And then I tried to do a self-referral to Mayo. Too late. The doctor already sent a bad letter, so they're like, "No, we're not interested in taking you." I tried to get into Mayo through my dad's a doctor. He knows a guy in Mayo. I tried to get through that doctor. I still couldn't get in. I was losing my goddamn mind. There were times like I can't believe I didn't shatter plates, break mirrors, whatever. It was amazing. There was times like kick stuff or whatever, or punch a loaf of bread, but like it's amazing the things I suffered and endured without literally causing physical damage around me. Your primary is convinced. Well, that's good that you have your primary on your side. I wish you the best of luck, and my brother is a moderator of the autoimmune encephalitis subreddit, which is a good place for input. And he is a little bit more articulate when it comes to these things. And he actually navigated more doctors than me when, throughout this, I was very despondent about our situation. Ice, what you were telling me is also what my brother told me, and he's an ICU doc. You have to feed them the symptoms the way they convince them, but that requires knowing how to make the diagnoses. Yep. You can't. You go in there and you start saying stuff, they think you just went to Google. But if you go in there and you start saying like, I have a stiff neck, my head hurts, I am forgetting things, I'm dropping things without intentionally doing so. You could say you kind of want to avoid like psychiatric things like hallucinations early on because they'll pin you on a psych very quickly. So you want to stay in the neurological realm of stuff. And even like I had to even like fake some like, even though I had a tremor, I exaggerated it, right? Because I wanted them to see I had a tremor. And they were looking for functional neurological disorder, where you basically have a neurological disorder that is not explained by any disease activity. It's just like some functional thing in your brain's going wrong. It's more of a psychiatric neurological thing intermixed. So some people will have tremors that isn't caused by a disease. So a doctor had me do this with one hand and shake, move my hand like this, pronate it so my tremor would show. And if you had functional neurological disorder, when you're doing this with one hand, you're distracted and your tremor in this hand will go away. And I was very aware of that because I had done a ton of research, I had seen a ton of docs, I knew exactly what I was looking for, and I was like, no, I'm not going to allow this guy to just get off and think I have functional neurological disorder. So I made sure that when I was doing this with my hand, I did have a tremor still, but I made sure to exaggerate it so he had no inclination to diagnose me with functional neurological disorder, because that would pigeonhole me and I would get nowhere. And I was in the hospital at that time. Can you describe your psychosis? It's hard to describe, but I can. While I don't think I went into full psychosis early on, I had a lot of crazy, intrusive thoughts and feelings of intense impending doom. So I would actually have hallucinations over my vision. It would be like dreams, but while I'm awake. People's eyes looked like demons. They were completely black. At times, when I was in deep psychosis, audio would lag with visual, so people would speak and I would see their mouths move first, and then I'd hear the audio afterwards. I would have paranoia, where basically I call it the spooks, but really intense spooks. And visually, things when that happened would elongate. So I was taking a shower and I had an episode of that, and visually the shower, whatever stall or whatever you want to call it, whatever that I was in, like visually elongated, and I had paranoia like come over me. I had episodes of where basically all feeling in my entire brain turned off, so it felt like I could not feel anything at all. I can't even describe that one. That one's impossible. There are a lot of weird different episodes that I have, and then extreme agitation. Like it felt like my brain was buried in a tiny box 20,000 feet under the ground. I was so agitated. It was inexplicable. If anybody else had it, I think they would have been screaming and crying and crashing shit. But your brain goes into defense mode and just goes, tough it out, tough it out, tough it out, you know. And even though it's something that, like, if my sister-in-law had, she'd be bawling her eyes out and smashing plates and shit. It was crazy. Do you read me? Thanks, dude. I'll hop over there. Wishing you both the best. Yeah, you did end up... We did end up in the psych ward. I did too. It got that bad, but I knew I wasn't crazy. But I was. Only subsides with prednisone. So yeah, I was in psychosis and really was brought out of psychosis with Solumedrol. The video went out again. It's really annoying. I think my camera might be dead. I'm kind of charging both my camera and my laptop at the same time. Hold on. Like using the same charger. So we'll turn this off. And back on. And then we'll select this and then this. Alright. I guess I'll just use my webcam for the last little bit here. Okay. So yeah, I'll use my webcam for the last little bit because I'm sharing a cord with my computer. My computer dies so fast, it's crazy. Yeah, so the psychosis is, and it's also, I sweat so much when I live stream, it's crazy. It's also so buried deep, like it's hard for me to remember sometimes, because I remember like sitting at the table staring at my dinner plate while my dad was talking about fishing, and I was like, how can he be talking about fishing right now? When I look up and I look him in the eyes and they're completely black and filled with static. And when I look him in the eyes, it feels, I look my mother and my father in the eyes, it feels like I'm looking the Antichrist right in the, like it's like the Antichrist is piercing right into my soul. That's what it felt like. And you know, it's like, how can we, and my brother Eric said, I can't stand it. He just stood up and walked away. You know, it's like, how can we talk about fishing right now when this is going on? My dad was very much, it was a psych problem. He said the Spinal Tap would be low yield. Lo and behold, he's more supportive now, but would have helped if he was supportive earlier. Not gonna lie, he did not believe me, and he thought it was folie à deux, but you know, it's tough when you have a medical doctor for a father and you want him to be on your side and believe you, but you end up in a psych ward, and you have to do everything yourself, and by the time you actually figure out that you're right, he finally flips to your side and tries to undo the damage he's done, but it's almost too late. I still love him, but it's hard to not, for my brain to not process him as the bad guy when he was in fact the bad guy for many years while I was living with them. Both visually because I was seeing them as demons, and because he was not on my side. He was very much against me and very much on the opinion that it was a psychiatric issue, and was a bootlicker to every doc who dismissed me. They gave me so many weird meds, and they all made it worse. They gave me a lot. I'm on a lot of meds still that I'm still coming off of. They made me suicidal ideation extreme. You said it best when you described the agitation. Yeah, the agitation was severe, man, and it never went away. Like, I never had a breath of fresh air. Like, I never came up for air. I was just agitation, psychosis, hell. Um, so much pain. And time dilation at night. Like, I still have time dilation at night, or I think it's been hours, but it's only been 30 minutes, so I'm sleeping. But the time dilation was crazy. I think I'd slept for 8 hours, and it had been 10 minutes. It was insane. And so nights were eternities, and then days were hell, and then nights were eternities again, and then days were hell. And I'd wake up every 10 minutes thinking it had been a full night. It was crazy. We all make mistakes, and I try to acknowledge that with my own father. But I also wonder, why can't he be like how my mother was? My mother was on our side. She was at our doctor's appointments. She wasn't exactly pushing for treatment, but she was behind us and encouraging us and believed us and all that. And then you see in contrast, your other parent doing the exact opposite. It's like, why are you making the mistake? Is it because you're a doctor too? Is it because you have an ego? I mean, he could be watching this right now, but he knows how I feel. Of course, I still love him. There's neural pathways that have been developed over the course of many years through him raising me and being a great father and going camping and loving me and all that. You can't let those things go. They're ingrained in the very fiber of who you are. But when you expect that leader in your life to take charge and he doesn't, and he fails you miserably, it rocks who you think, it rocks your reality and who you think he is as a person in relation to you. And so that's something that's is really tough for me to deal with. I treat with him, I treat it like everything's okay. On the inside, it's not okay. I've had dreams of him beating me, and my dad would never beat me. He would never lay a finger on me. I think he maybe yelled at me once in my entire life, since I went out and banged a girl and drank out of his liquor cabinet, and he half yelled at me. But he'd never hit me. He'd always hug me. He still hugs me. He's always very affectionate and all that. And but I'd have dreams of him beating me, because that's how I viewed him, because of how he handled the whole situation. Anyway, I'm not gonna go too far into therapy, and I don't want to disparage my own father too much, because we do all make mistakes, and he's been through med school, so he's meant to look for horses, not zebras, and he doesn't. I don't know. There's things he could have done better. Like, could he not have researched autoimmune encephalitis a little bit? I'm on a testosterone replacement therapy, and he was very convinced that was the issue, and I knew it wasn't. I tried getting off multiple times to prove that he was wrong, but of course I had low T problems that worsened my psychosis and made me incredibly depressed. Do you read me? As a fellow mom, you know when your kids are telling the truth. There's something special about moms. Something special about my mom. I tell her many times that she's a fountain of all good things. I don't think there's nothing that comes from her that is not good. She's a fountain of goodness that never ends. And sometimes she says, I wish I had done something with my life. And I'm like, woman, you've raised 5 amazing children. And not only that, you were in the trenches with us for 3 years during the hardest battles and the most crazy shit that could ever possibly happen to a person. And you have to deal with that trauma, on her own. She's a wonderful woman. Am I sad, but also realize everyone working in that system is institutionalized into thinking a certain way that leaves them broken. And I think, had my dad not gone to med school and become a doctor, maybe he would have had a different perspective. But, all doctors treated me the same, so why would my own father not? He was very concerned. Don't get me wrong. He was not unconcerned with what was going on. I don't think he understood the gravity of the symptoms, and he did not believe the root cause of the symptoms until ultimately, Eric and I, of course, did our own thing because we knew what we had. We went down the chain of doctors, all 9 neurologists, and the chain of medications until we went into remission with Cytoxin, and then, of course, he believed me by that point. He admitted to believing earlier on, but he also left a little window, a little corner for it being a psych issue. But I had laid out all my paperwork and tried to convince him of it. Anyway, I'm not gonna go into a therapy session too long about my own father, because he's a great man. If you met him, you'd love him. There's not much to dislike about him. He was an amazing father, and he was an amazing provider. It was just a certain kind of fucked up situation where I'm looking at the wrong camera, where it was just fucked up in just the right way that it was hard for him to navigate. So I have to be somewhat understanding in some ways. Okay. I don't know what I'm going to do with the rest of my day. Big dinner here soon. But tomorrow's the fMRI, then TMS on Thursday. And we'll keep blasting at TMS. And hopefully we'll see a lot of improvement. I appreciate that. Thank you. I hope one day I can be a dad and be there for my kids, Alright, guys. Love you very much. Thanks for the encouraging words, and I'll be live streaming more later down the week. For now, this is Adam, signing off.